Welcome, everyone, to the La+Jolla+Cosmetic podcast. I'm your hostess, Monique Ramsey. My guest today is Lauren. She is a patient coordinator for our signature Skinny+Shot. And welcome, Lauren.
Hi, thank you.
So tell us a little bit about, how you help patients within the practice.
Yeah, so kind of my role within the Skinny+Shot program is to get everyone started and kind of make sure that to facilitate things along the way. So in terms of when people call in and they want to hear about the program, I can answer a lot of those questions, give them kind of the rundown of what to expect. And then if they decide that this is something they want to pursue, I can go ahead and get them set up with all of the necessary appointments. First, they have to do their blood work, and then they have to have that virtual consultation with Dr. Haas. And so kind of all those things to get them to their first appointment where they're actually receiving the medication. And then from then on out, I'm just, kind of in charge of making sure that everything stays in order for them and on track, and that I make sure they get their medication if they're, when they need it, and schedule all those things and kind of the back end of things.
Yeah, I feel like you're really a partner in their care. And, it really sets us apart, I think, from some online service where you might get a Skinny+Shot. And so it's like you're there in it's kind of a buddy system relationship with them to help them through the whole process. And I think that's really a nice thing. And we have an episode where we did a meet Dr. Haas. We did a Skinny+Shot episode. We did a meet Jason. He is an RN and is on the medical side. And then you're really that best friend throughout the process to help them, navigate for however long that they're doing their Skinny+Shot. But really, you're probably their first point of contact, right?
Yes, probably definitely their first point of contact. And then, Jason and Dr. Haas are so busy. And so if I can help, answer any of those easier questions, maybe not the medical questions, but just billing or scheduling or all those things, then I can kind of take on that and then make their journey as smooth as possible. That's kind of my goal.
Yeah. And I feel like it's a really kind of a concierge experience in terms of that, hand holding and because, not everybody's done this before or comfortable with it, or you might have done it somewhere else, but you really wanted that more one-on-one connection with the team. And we've gotten such amazing feedback from our patients who've gone through the Skinny+Shot because we're coming up on, I think we've been doing it since February. So we're coming up on a year. And so you're talking to patients like all day long, right?
All day long, all day, every day. Yeah. It's pretty fun, actually. It's fun to see the little victories. I get to get a lot of, I'm texting with them all the time through the software and just kind of checking in with them. And then I get a lot of people going, "Hey, Lauren, I've lost 20 pounds today," and kind of getting to see those little victories is really, really fun.
Oh, how fun. I would love that.
Yeah.
It's like all the happy people. And, and for, I think, in terms of patients who might, let's say they hit a plateau, do they talk to you or do they talk to Jason or Dr. Haas?
Usually they'll talk to me first and just say, "Hey, this is kind of what I've noticed, and I think this is what's happening." I can kind of talk through that with them a little bit. And then usually if I agree, I think, okay, yes, I think this is a plateau. I think you've been on this dose for so long, however many months that your body is starting to adjust. Then I go, okay, next step is Jason. We're going to talk to Jason. He's going to then, want to have a conversation with them over the phone and decide, do we need to go up? So kind of just, if I can take, kind of that middleman position, it kind of helps field some of those calls, because sometimes people are, they get a little worried and they just want to have someone reassure them that, okay, I'm doing the right thing. And so I can kind of talk to them and just hear, how are you doing? Like, what are your, habits like? And they just kind of want someone to talk to them like that.
Yeah. Yeah. And I think everybody's so different, everybody's body's different. Some people start losing weight right away. Other people, it takes a little while to kick in. So, it's having that partner, and you have, and Jason and Dr. Haas have the benefit of working with so many hundreds of patients that we kind of can see, like, what are the norms, what are the outliers. It's okay, and then know when we might need to intervene with a different solution. So, or transfer to maintenance. So, we've had a lot of people hit their goal, and we have maintenance plans now, which I think is awesome.
Yeah.
Especially right now, where maybe you've made your goal and now the holidays are coming and you're like, I want that food noise to go away a little bit. So, like, could maybe have a low dose or something where you can kind of get yourself through the holidays without backsliding.
Yeah, for sure.
Yeah. So tell us about your background and what led you into aesthetics or specifically to us at La+Jolla+Cosmetic Surgery Center.
Yeah, so I am originally from Washington. I'm from a really small town in Washington called Leavenworth. It's kind of in the smack dab middle of the state, kind of in the, it's a super tiny town, not a lot of people. And so I ended up going to Washington State University, which is in Pullman, Washington, for college. And originally I was going to do nursing. That was kind of my plan my whole life, was to do nursing. And then somewhere along the way, I kind of decided, actually, I don't know if this is what I want to be doing. I really liked it. I liked the helping people part of things. But it was also just kind of hard. You see people kind of on their worst day a lot of the time, and it's just a little bit sad at times. And so I did my CNA, which is a certified nursing assistant training. And I just decided, you know what, I don't think this is for me. And so I decided to switch my major, and I did psychology because I've always loved working with people. And I figured that would be a good degree in terms of just working with people and learning about how people work and their thought processes. And that kind of was just an impulse decision, really. And then I ended up moving to California kind of out of nowhere. My best friend got a job here. And so then me and our other friend said, we're in, let's go. We're coming with you. And we all just kind of moved down here. And then I graduated shortly after. And I just kind of got to thinking about, what do I want to do and what should I be applying for? And then along the looking of, for jobs, I saw this one and I was like, oh my gosh, that would just be perfect because it's working with people and it's in the healthcare field, but not, the sad parts. Obviously, when you're here, everyone is just thrilled and everyone is so happy to be doing what they're doing, whether that's weight loss, whether that's surgery. People are excited to be here. They're happy with their results. And you're really just giving people confidence and just life-changing things are happening here. So it was kind of the perfect combination of those two things. And so I really am happy that it worked out so well. And I think it was kind of the perfect job for me.
That's awesome. I love it. And now tell me the name of the town again.
It's called Leavenworth, Washington.
Leavenworth. Okay.
Yes, it's about 3 hours from Seattle. It's very well known by the people there, but when I talk about it in California, no one knows what I'm talking about. And it sounds a little quirky because it's a German-themed town.
Oh, really?
So it's themed to be like Bavaria, like you're in Germany. But it's just a little tourist destination, and it's
fun.
Pretty cute. Yeah.
Oh, I'm going to have to go check it out.
Yeah.
I think that sounds adorable.
It's pretty adorable.
So tell me about the differences, like growing up in Washington, and what have you and your friends, now that you've been in San Diego for a little while, what do you guys think?
I love it. I think I moved here with 2 of my best friends, and I think out of the 3 of us, I like it the most, which was kind of surprising because they were really, really gunning to come here. And I mean, you can't beat San Diego weather. Obviously, we were all just home for the holidays for Thanksgiving, and it's fun to go visit the snow, but I certainly do not miss it.
So it was snowy where you were, huh?
Oh yeah, really snowy. My hometown is referred to often as Christmas Town, USA.
You're kidding.
It's very wintry wonderland. There's lights on every building. So when you go there, it's very Christmassy and holiday.
I want to go.
Yeah, it's really cute. Yeah.
Oh, neat. That's so cool. I love it when, you feel like, especially, I'm a San Diego native, so, I've barely seen snow 5 times in my lifetime. So it's, we are used to kind of that California Christmas, but I think to be able to go somewhere on a plane for not have to fly that far to get that same feeling, that's really cool.
It's perfect because the part of winter that you want to experience is the fun and the pretty snow falling and having the fire and the sitting inside and watching the fire while the snow falls. But the part you don't want to deal with is scraping your car windows every single day and shoveling the driveway and all those things that I certainly do not miss. So yeah, I get to have the fun little bits and pieces when I go home now.
That's so nice. So are you going to go home at Christmas too?
Yes.
Oh, good.
Yes,
That's
very
nice.
excited.
Yeah. So tell me a little bit about, now that you've been around San Diego, what have been some of your favorite places to go, whether it be food related, whether it be activity related? Like, what do you like to do?
I am a very, very picky eater, very, very picky eater. And so I'm trying slowly but surely to expand that. And so part of what's been awesome about living in San Diego is I think I could live here my entire life and not see a portion of the restaurants that there are here. There's just so many. But I really enjoyed trying new ones. And where I'm from, it's the same thing over and over again because it's a town of like 2,000 people. And so it's teeny tiny. And so having something like this where I'm in a city and I can just I can go around and try all these different variations of food from different cultures while not even leaving the city has been
Yeah.
really fun. I think it's hard to really say what my favorite is. Ironically, what comes to mind first is just the little things. Like my hometown had one McDonald's and that was it. And so the fact that I can go and just like easily access like a Chick-fil-A
Yeah.
is lovely. It used to be a 3-hour drive to get to a Chick-fil-A, and
No
now I can
way.
go to one so easily.
I know there's that one in La Jolla now too.
Yeah.
So it's like, ooh, I don't have to go all the way to Mira Mesa. I can go to the one by UTC.
Yeah.
Um, yeah. Now tell me, because it's all about the tacos. So have you found any
hmm
taco places, and what do you like?
I don't think I have. I haven't found anything that really sticks out. But I mean, I have had many a great taco here, but nothing in this particular I can think of that's like my go-to place. I'll have to keep
You
looking.
have to keep looking.
Yeah.
Exactly. So, what advice would you give to somebody if they're thinking about, maybe changing their life with, their weight?
hmm
What kind of advice would you give them about getting started? And I ask you because you've talked to so many patients on that first phone call. And
hmm
so, are people nervous when they call, or are they like ready to go? And what advice would you give?
I would say most people are nervous. It's been really interesting to talk to so many people about it and kind of hear, not only the reservations they have coming in, but then how happy they are they did this at the end. And so I can use those conversations when I'm talking to new patients and they're saying things like, "Oh, I'm just so nervous. Like, I've never done this kind of thing. I've never done injections." And you hear all these scary things in the media about, celebrities doing these things and it has this certain stigma. But to kind of get to tell them, like, it's likely going to be one of the best things you can do for yourself because you're just going to gain all this self-confidence back. And people also, I think, are worried that, this has to be something they have to do for the rest of their life, or this is something that's only going to work for a short time and then they're just going to gain all the way back. And so to kind of reassure them with all these other people's experiences I can talk to them about and
Mhm.
just let them know that you're not alone in how you're feeling. Everyone feels nervous to start something like this, and everyone's worried about, oh, are people going to think differently of me? But really, you're giving yourself the greatest gift, which is confidence. And if you can do that, if you can do it this way and get yourself to where you want to be and then because you still have to do a lot of work. It's not like it's a magic drug. It's not like you just inject yourself and boop, you lost 10 pounds. You still have to really put the work in and be dedicated to the program. So it's not like an easy out. It's just, you still have to really try pretty hard. So I think just reassuring them that no, this is not a shortcut. This is just how you're gonna do it, and it's how it's gonna, be best for your lifestyle, and you're gonna feel amazing at the end. And then they always are so happy that they did this.
What you're saying that reminds me of one of our patients. We'll put it in the show notes. We'll put um, links to some podcasts we had with real patients who've gone through the program. And one of them, she said, she doesn't understand the stigma because she said, if it was some treatment or drug to help stop alcoholism,
Right.
you would never think twice
You wouldn't think
about you.
twice.
Everybody would be like, yeah, of course,
Mhm.
rather than like, okay, weight loss and a better, healthier you is
Mhm.
no different and they are, every day. I'm on Medscape, and I always see these articles like they're finding it helps with cardiovascular
Mhm.
risk, and it helps with the semaglutide and the tirzepatide. They really are helping people in a lot more than just weight loss. And, kind of think about the after effects if you're too heavy, the diabetes risk, and all the different risk factors that go way up with a
Mhm.
higher weight. And these are very safe medications. And I think it's interesting to be able to sort of, like you say, reassure them that these are safe, and it's physician supervised. So Dr. Haas,
Right.
we're doing lab work, or you have Dr. Haas go over your medical history. We work on your dosing, and there is that supervision factor, which I think
Mhm.
is the reassuring part as a patient, to go, I don't know anything about these drugs. I'm assuming you do. And that you
Yeah.
guys are the ones on the side to help, keep it safe, keep it, making sure that, you're doing the weight loss in the right way, drinking enough water and having enough
Mhm.
protein and all those things. But it is a game-changing drug, I will say, for somebody.
Life-changing. So
Yeah.
life-changing for so many people, and it's so fun to see. I see them usually once a month when they come in to pick up. I'll see them in person, and I see them just kind of slowly, getting back down to that goal weight, and I also see them just looking happier, and I can't tell you how many people will send me messages saying, "I've never felt this confident. I've never felt this happy." And it's just because, like you said, obviously having a lot of extra weight can be have effects on your physical health, like your cardiovascular health and all those things, but it can also have effect on your mental health and just how you feel about yourself. And then so if you can do something that's going to make it so you feel like the best version of yourself every day, in a way that also, this is probably for most people going to be a 6 to 8 to 12 month process. So it's not like it's overnight. And it also gives you this amazing chunk of time where you are able to really hone in on your dietary and lifestyle choices, your exercise routines, your diet, like all those things. And that way, people, when they finish the program, they've had months and months and months to change their actual habits. And that's how people are successful moving forward, is they've actually done the work and changed their habits. If you just did this medication, lost a bunch of weight, and then returned back to your old lifestyle the next day, it's all going to come back. So I think that people have to remember that, this isn't just a magic drug. It still is a lot of work, and you're just helping yourself get there, and you're going to thank yourself for it.
Yeah. Yeah. And I think, the big key is that, having that aid. And I
Mhm.
think the way that it works on your brain almost as much as it works on your stomach, you
Mhm.
feel fuller, quicker, for longer, but your brain isn't thinking about food as much. And I know for me, that food noise, they talk about food
Yeah.
noise, and it's just like, what am I going to eat next? Or, oh, I want more of something. And it kind of goes away. And I think that's why they've even been using this drug for helping people who are, addicted to different chemical substances or alcohol, because it does quiet that part of the brain. And
Mhm.
I don't know if we know why yet, but it works. And so it does allow you to then have the freedom to make those changes to your lifestyle and to do,
Right.
so like, oh, because I'm not so stressed out about this other part that's kind of
Mhm.
being handled. Okay, I'm going to focus on walking one more day a week, or I'm going to focus on, what adding more protein, because that's a hard
Mhm.
thing. If you're eating a lot less, you should be eating the right things. And
Right.
so that kind of stuff. And I love the fact that you have the history of all the patients that have been in our program to help coach people
Mhm.
through whatever challenges or, frustrations they might be having at any one point. So that's really
Yeah, I think
nice.
it's reassuring to people because it's one thing to have me just say it, but if I can say this, all these other people who were in the same shoes as you were having the same fears, they had the same victories, like everyone is, it's comforting, I think, to a lot of people
Mhm.
just to hear that, okay, I'm not alone. And it's just not just me saying it. This is people who actually have gone through the same exact thing as them.
Exactly. And we'll put also in the show notes, not just those podcasts, but we also have a on-demand webinar that we did with Dr. Haas. And so we'll put that in the show notes with a link. So all you have to do is kind of register for it. And then the moment you do that, you'll have the webinar to play and listen to, which I think is really great. Um, So, last question. At La Jolla Cosmetic Surgery Center, our brand is where dreams become real. So, Lauren, tell us about a dream of yours that has become real.
I mean, this is a little bit silly, I guess, but I had always dreamt of going to the Italian coast. And I did a trip to Italy with my best friend about 2 summers ago. And we went to the Amalfi Coast, and it was definitely dreamlike. It was really a really amazing trip and something I never thought I'd get to do.
How wonderful. So, what was that? Do you remember like the inspiration for the dream that I want to go there? Or was it a movie, or did you read something, or?
I think just the dream to travel. I think everyone wants to get to travel around. And I guess even moving here was kind of a dream that I got to do. And just, I don't know.
Well, it's and now that I'm 56 and I'm staring down 57 in a few weeks, you know, I feel like the time when you're young is the time to like do those crazy things. Like, yeah, I'm going to move and let's just do it and see what happens. And those are those chances you can take when you don't have kids and
Right.
your job is in between, whatever. I think it's makes it easy for people to go, oh, what's the worst that can happen? If I don't like it, I'll go back. But where you can do those fun, take a chance type dreams. And so do you think now that you're here in San Diego, do you see yourself living here?
That's the question. I think, yeah, I think I'll definitely be around for some years for sure. I don't know about for the rest of my life. I love San Diego so far, but it's definitely a city, and I do kind
Mhm.
of like the small town vibe, but not right now. At this point in my life, this is perfect. So,
Yeah. And that's a perfect answer to be like, yeah, it's perfect for now.
yeah.
And it might not be perfect in a few years, and that's okay. So I think it's, just all adds into your life experience. And that's fun that you shared it with us. I appreciate that.
Yeah.
Well, thanks for showing us, telling us about what you do at La Jolla Cosmetic and explaining to the patients a little bit about your role in helping the skinny shot patients realize their dreams and getting their confidence back at their fighting weight, as they might say, at their goal weight. And so thanks again for coming.
Yeah, no problem. Thanks for having me.
Okay, I'll see you on the next one.
Take a screenshot of this podcast episode with your phone and show it at your consultation or appointment, or mention the promo code podcast to receive $25 off any service or product of $50 or more at La Jolla Cosmetic. La Jolla Cosmetic is located just off the I-5 San Diego Freeway in the Zymed building on the Scripps Memorial Hospital campus. To learn more, go to ljcsc.com or follow the team on Instagram at ljcsc. The La Jolla Cosmetic Podcast is a production of The Axis, TheAxis.io.